everyone. I'm Dr. Kelly Morales. I'm an generalist OBGYN here in San Antonio, Texas, and I want to take this opportunity to begin a conversation with you. I practice general obstetrics and gynecology. I see pregnant women in my office. I see regular well-woman exams, and I see problem GYN visits as a specialist. So I wanted to begin a video series to have a conversation about the different problems that come into my office that we have different treatments for, and specifically for female pelvic health. So I hope that there's going to be more videos just like this one. So please let us know. Let me know if you like it and if you want me to do more videos. I have some ideas for some other topics, and would just like to share some stories with you and share some options for treatment. This is not a sales pitch, basically just a good conversation to have. And if you are having any of these sorts of problems, please come in to see me, get a consultation, or talk with your gynecologist about them, because you should not have to deal with them and suffer alone. So I'm going to give you an idea of one of the situations that I'm talking about. I'm not going to use patient names or specific patient details, but I do have a number of patients that come into my office with a history of breast cancer or entering into menopause. One patient that I can think of in particular is a young woman, and she's been diagnosed with breast cancer within the past couple of years, and nobody told her that part of the deal was going to be that not only would she start to have issues with things like vaginal dryness or pain during intercourse and intimacy, but also problems with her bladder, and that she would start to have urinary urgency. And the source of this is the lack of estrogen, because when you have breast cancer, the treatments involve targeting your estrogen and getting rid of the estrogen that could cause that breast cancer to grow and develop or reoccur. And in doing that, we put you into menopause. And when you lose that estrogen is crucial for vaginal health. It helps to keep that vaginal mucosa moist, lubricated, thick. It helps to support the bladder. It helps with your overall comfort in the vaginal walls. And that comfort, that moisture, that elasticity is needed for intercourse. So I have a patient that I mentioned that has that vaginal dryness issue, and she stopped being intimate with her husband. It was too painful. She was getting micro tears. It was uncomfortable. It would bring her to tears, and that is not a way to be intimate if it's too painful. So that was starting to affect her relationship. So I want to bring to the forefront the fact that there are treatments available. Sometimes these treatments involve replacing hormones, which for certain populations is not a great idea, especially a breast cancer patient. We don't want to introduce systemic estrogen or estrogen tablets or creams or patches, because then we could make the breast cancer situation worse. So there are other options as well. There are vaginal moisturizers. There are treatments that can bring your own healthy tissue cells to replenish that tissue, such as the Votiva vaginal rejuvenation device. There's also different kind of lubricants and such that can be used for intercourse. So that's just one example, and I want to bring that to light, the fact that there's many women that have this issue and suffer from vaginal dryness, whether it's somebody who has had breast cancer in the past, or maybe somebody who is breastfeeding, and breastfeeding can lower your estrogen and cause you to have the same type of vaginal dryness that I'm talking about, or maybe somebody who is entering into menopause or has been in menopause and their estrogen levels have been depleted, and they're walking around with a discomfort and having problems with intimacy. So if this sounds familiar to you, don't just suffer. Again, call me up, let's set up a consultation, let's chat about your different options, or talk to your gynecologist. This isn't something that you should just have to deal with. So there we go, let's get the conversation started. Let's talk about things like vaginal dryness and pelvic health, because this is important. This is important for you, this is important for your relationship, and I think that there's things that can be done about it. So again, Dr. Kelly Morales in San Antonio, And let me know if you'd like to hear more about this. Let me know if there's other topics that you'd like to chat about. Thank you. Have a good day.